What is your assessment of what's caused the increase in suicide rates and drug addiction and stuff that you mentioned?
It's a multitude of things. You see this nationally. It's not just American Indian, Alaska Native people. You see it everywhere.
But not to that extent.
Not to that extent. Yeah. But I think there's a lot of things that contribute to that. Social determinants of health have contributed to that, and just the lack of people feeling like they can't get out of whatever situation they're in. It just leads to hopelessness and helplessness.
And you mentioned the difficulty of finding healthcare workers and stuff in Alaska. And I mean, this is an issue we've talked about many times, but how do you get a doctor to go to a remote village in Alaska that he's got to fly to be there and stuff? That's got to be a real challenge.
Yes, it is a challenge. We don't expect doctors in every single community. I mean, that is not going to work. So we have a system where you have community health aides in the smaller areas, and then in some of the hubs you have physician assistants and nurse practitioners. In the larger areas they have the doctor. So it creates this web of care throughout the state. But we just don't get enough doctors at all. And I'm also speaking on behalf of all tribes. It's not just Alaska, but all tribes have this issue too, and it's the same thing. It's rural sites. There's no housing. They go into a community that they really don't know the population. They don't know the culture. They don't understand things, and it seems very foreign. Some people thrive in that situation, but some people don't.
Some people retire to that situation.
That's right. You're absolutely right.
Do you do a lot of telemedicine?
Yes, we do. Yeah. And we increased that, especially because of COVID. We went to a lot of telemedicine then. I mean, we always did it, but we increased that a lot because we wanted to ensure that people got the care they needed, even if they couldn't come in. And people were actually pretty receptive to that. The people we serve are empaneled to their provider because we want them to get to know their provider and their provider to get to know them and build that relationship. And because those relationships were built, we were able to actually do that type of care, by distance in a good way. People were receptive of it. But I will say that after 2.5 years, I'm stumbling because I want to say customer owners, because that's what we call patients as customer owners. After 2.5 years, our customer owners said, no, I want to see my provider. And so they started coming back in, and, we limited, times and people within our system, but it actually worked out well, and we did see a decrease in some of our statistics, but not by much, not compared to some other organizations.
Thank you. Ms. Pingree.
Well, thank you, everybody, for your testimony, and appreciate both the healthcare perspectives from Alaska and just the magnitude of the area you have to cover is enormous, and really appreciate many of your thoughts, and good luck with the new hospital. I'm glad to hear that's moving forward. That seems like a really significant move, and an 80-year-old facility that's pretty darn old to have to deal with. And thank you for your Vice Chairwoman, the things you brought up about law enforcement we've been talking a lot about today, and just the very idea that you might have to drive somebody 8 hours to get to a facility is really unthinkable. But the chair talked about that earlier, about the complicated web of who has jurisdiction, and then the disagreements with jurisdiction when the county doesn't always get along with the thinking of the law enforcement of the tribe. It shouldn't be such a complicated problem. So I hope we can work on that more, and very interested to hear about all the work you're doing with wildlife management. And it's interesting. I come from Maine, and we have a growing kelp industry, and I was just visiting one of our kelp processors the other day, and they were like, we got to pick up the pace. Alaska's going to take over. So, but there you go. But I mean, there's a huge future in aquaculture, and we both have states with huge fisheries. We're tiny compared to Alaska, but with the changing temperature, with a lot of factors going on in the ocean, it's really important that we're investing in aquaculture. So, I hope we can offer you more support in the kind of resource management that you're doing. So, thank you all very much. Thank you. I yield back.
Thank you, Mr. Chairman. Thank you all for being here. I'd like to point out the Woodbury Forest School on their government class trip. Thank you, gentlemen, for being here. We've been doing this for 150 years with the tribes, and haven't gotten it right yet. And this just continues to tell us that. And as we talk about the suicides and the opioid abuse rates, and with the lack of law enforcement on the reses, now the cartels are moving in and killing our young men and women and killing our future. So staggering statistics, and it's a tragedy and a travesty at the same time. And Mary Jane, I just want to tell you on a brighter note, I could hear you talk, I could listen to you talk all day long, and so you hold us in rapt attention. You have a beautiful voice, and it's I think you should be in movies. You're very good at it. But thank you all for being here, and we have to get these things right. So thank you, Mr. Chairman. Yep.
Let me just ask this before I go to Betty. Representative Elsie mentioned the fentanyl and stuff crisis. We've heard that on all the other reservations that are down in the lower 48. Same thing happening in Alaska?
Yes, it is, and it's going up just like every other place.
Is it?
Yes.
Because of its remoteness? And I mean, I'm wondering, how the hell does a cartel get out to some place that's so remote and stuff, But I guess they are geniuses that way.
Yes, they are, and it is slower. Trank, that probably everybody's heard about here, has just now reached Alaska. So it's a little slower getting there, all the stuff, but fentanyl has been there for a while, and we have seen a marked increase in deaths. It's slowed a little bit, but it's still increasing every year.
Yeah, I know that's a big issue with the Nez Perce and stuff. I've talked to the chairman quite a bit about it. So, Ms. McCullum.
Thank you. The conversation, it's a delicate one to even talk about, because whenever you talk about suicide, you want to offer resources immediately. So Congress has been working on a first call for help and other things. But in this room, back several years ago, we had some tribal youth, the future, young adults, talk about what was going on with suicide at the time at Pine Ridge. And we put some dollars into suicide prevention on that. So this morning, we kind of focused on education. People were talking about Johnson O'Malley, drug courts, early intervention for youth. I would just ask, being outside, with an adult, taking that deep breath, having someone pay attention to you, or just walk silently next to you. In Alaska, with the remoteness and its suicide rates are going up for our youth all across the country. People are feeling hopelessness. Some of it was contributed to COVID. Some of it might not be contributed to COVID. What are some of the things that, especially with youth and suicide, that it's best to talk to them as they did to us? We closed, after the hearing was done, we sat in a room with the doors closed and just let them talk. But are there some things with mental health, especially for young adults, that you think we need to be aware of as we put this budget together?
I think mental health overall has not been funded. And I think that suicide is a very complex problem. And so there isn't one nice solution. I wish there was. I really do, because whenever a suicide occurs, it affects everybody. It's really horrendous. So it's going to take a multi-pronged approach to even come close to making a difference. I think it's really important that people learn to be proud of who they are and where they come from. And so, there's a lot of effort within tribal communities to build up the culture again, and to, teach young people how to be culturally appropriate and what it means to be a part of that tribe. I think things like that help. I think support for families also help. Like I said, it's a multi-pronged approach. It's not going to be easy, but ignoring it doesn't mean it's going to go away. I think it's going to get worse before it gets better.
Mr. Edwards.
Thank you, Mr. Chair, and thank you to our guests. I really appreciate you taking time to be here to share your stories and talk about what's important. I know that you traveled a great distance to be here. This committee would not have the opportunity to hear from you had you not made the financial and the time commitment to be here. I want you to know that your testimony, your comments are meaningful. There are a lot of needs for our tribal nations in this country. I wish that we could go and meet every one of those instantly. I doubt that we're going to be able to do that, but you being here is extremely, extremely meaningful in us knowing what those needs are as we make our decisions to help prioritize those. So thank you.
Thank you. And I should tell you before I let you go, I really do appreciate the work that resource people do in both Alaska and what the Nez Perce do in Idaho and other tribes and stuff. Having studied Idaho salmon runs, which are endangered, and they will go extinct if something is not done. I will tell you, my firm belief is if it had not been for the Indian tribes, those fish would be extinct today. But the incredible work that they've done in keeping them alive until we can get a solution that gets them off the threatened and endangered list and gets them back to levels that, every tribe in the Pacific Northwest, now I'm off on my soapbox, every tribe in the Pacific Northwest, when they sign treaties, they retained their right to fish in their traditional places of fishing. Guess what? Those rights don't mean anything if there's no fish there. And especially if the reason there's no fish there is because of actions we've taken. So we have an obligation there, and you tell Chairman Wheeler when you see him that I'll be up there this summer, and we'll talk some more about this. But we've had many great conversations with over the years at the summits and stuff that we've been at. So thank you all. Thank you all for being here today. I appreciate it very much. Let me get on to the next. That's on the next page. Just those two? Okay. Quinton Swanson and Esther Lucero. That's as close as it gets for me. Lucero. If I say it several times, one of them will be right. English was never my major in high school. Thank you for being here today. Quinton, you're first.